Traveling is high on the list of things people miss pre-coronavirus. And now with a new variant, it'll take a while before traveling can be the same as before. But if you're itching to venture out, there are guidelines and restrictions you need to be aware of, and precautions you need to keep in mind to lower the risk of COVID-19 transmission. On today's program, we'll help you navigate traveling in this new normal. I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk right here on CNN Philippines. From travel papers to health standards, some of you might be confused about the many requirements when traveling in this new normal. But they're important during these challenging times. Our guests are here today to help us understand these protocols which are in place for your safety. With us is Dr. Vivian Camacho. She's a family medicine physician and associate professor at the UP Manila College of Public Health. We're also joined by Tourism Secretary Berna Robulo Puyat. Thank you both for making the time and joining us. For now, there are many restrictions on the entry of foreign nationals in the country, especially with the new COVID-19 variant that's around. And there are additional rules that have been set in place. Now, as far as local tourists are concerned, there are provinces that are now open for visitors, but safety comes first. I'll start first with Secretary Puyat. Let's remind our viewers, ma'am, about travel restrictions in place.
Yes, thank you, and thank you for inviting me today. Doc, with regard to all the travel and local tourist destinations, with the exception of Boracay, all these health protocols are up to the local government unit. For example, let's say in Baguio, they started out with you can't go there without a negative RT-PCR. But now they are accepting already antigen tests. But most, except for Baguio, most tourist destinations ask for a negative RT-PCR 48 to 72 hours before travel. So that's for Boracay, Ilocos Sur, Ilocos Norte, Bohol, El Nido, and Coron, and Siargao. But like in the case of Ilocos Sur, even if you have a negative RT-PCR, as soon as you arrive in Ilocos Sur, they require you to take another antigen test. If you are planning to travel to any local destination or you want to come home, it's best really to look at the different protocols or the protocols where in the place where you want to go to.
Continuing with Secretary Puyat, local governments are in charge of drafting and enforcing these safety protocols in different provinces. Could you explain to our viewers, how does this work? What's the thinking process behind this?
You know, most of the tourist destinations were already under a modified GCQ, MGCQ, as early as June. Ibig sabihin, pag MGCQ, pwede na ang tourism. But they were quite hesitant to open. Though their livelihood comes from tourism, the locals were quite worried na ang tourists ang magdadala ng COVID sa kanilang probinsya. So what we do in the Department of Tourism, as early as June, we really coordinated already with the different LGUs. We asked them, why are you hesitant to open? What do you need? For example, in the case of Baguio, Mayor Magalong, Baguio City, they were already under MGCQ as early as June. But then they said that based on the consultations with the locals, they were going to open September. And they said that they needed a digital app, an online registration form. So before going to Baguio, you have to go online in this Visita app, and then doon lahat ng kailangan mong ipadala before they allow you to go to Baguio. When they allow you, they then give you a QR code, and that is like your passport, where when you go around Baguio, that's what you show to everybody. And we realized that that's what all the LGUs want, like an online registration form, a digital app for contact tracing. And then, for example, in the case of also in Boracay, what we did was the DOT through the TPB, we downloaded 10 million so that we could test all the frontliners RT-PCR para lang to increase travel confidence na whoever goes to Boracay sure sila na the waiter, the front desk, the people that they get in touch with are negative with COVID.
That's right. So everything is still very dynamic. So it's really best, like what you said earlier, to have a little bit more planning out, know the specific rules of the place that our viewers want to visit. Now, a big cause for concern for many is this new COVID-19
Yes.
variant. Maraming nakakarinig nito, no? Now, going to Dr. Camacho naman, what's the impact so far in terms of our day-to-day, ngayon na may news of this COVID-19 variant?
Tayo ay meron pa ring takot, no, so yung sa existing COVID-19, tapos dumating nga po itong balita na may new variant for COVID-19 na pwedeng makadagdag talaga sa anxiety at fear ng public, no. And syempre mas lalong nagiging strict, no, ang implementation ng ating mga public health standards lalo na. At isa syempre sa pwedeng maapektuhan ay yung pag-travel ulit natin, no? So parang unti-unting nag-o-open pa lang ang ating turismo ulit, tapos ito na naman ang new variant.
Now, before you book that flight, there are important travel restrictions that you need to know. Secretary Puyat, keeping in mind this new COVID variant, who are allowed now to travel into our country?
Well, actually, there are no foreign tourists allowed. We only allowed last December 7 balikbayans. So we were quite excited since the balikbayan market that's mostly coming from the United States. They are our third largest source of travelers. So, but we are really actually, even before this UK variant, the Department of Tourism has already been focusing really on domestic tourism. Tourism contributes 12.7% to the country's gross domestic product, GDP. And domestic tourism is 10.8% of the 12.7. Foreign tourists are only 8.26 million. Though that was a record-breaking number, it is small compared to the number of domestic tourists. Last 2019, we had 110 million domestic trips. Our focus is really on strengthening domestic tourism.
And since you mentioned that, how about domestic travel? What can our viewers expect if they want to travel by air domestically?
First of all, before you travel, we already have also a travel app that really summarizes and updates the different travel protocols of each local tourist destination. You can travel, we can restart tourism, you can enjoy the tourist destination, but you have to keep in mind three things. First, always wear a mask. Especially kung you get to see somebody you don't know kung saan siya nanggaling. Wear a mask, wear a face shield if you can. Always practice physical distancing and always wash your hands. You always have to have those three guidelines.
Yes, are very important tips, and we will talk more about those as the show goes on. And of course, as Secretary mentioned, there are minimum health standards in place to secure the safety of all travelers. And it's important that we're aware of these wherever we may go. Kahit pa ulit-ulit na nating sinasabi ito, it's really important that we don't lose sight of these very important measures, which are even still effective even with this new variant. So, Dr. Camacho, what are these minimum health standards para ma-refresh ang memory ng mga viewers natin?
Dr. Gomez, tama ka, no? Baka nakukulitan na ang mga tao dahil parati itong naririnig. At syempre, medyo may mga nabanggit na rin si Secretary, no? Ito sa ating minimum health standards. Sabi nga, ito na ang new normal natin. So, dapat talagang masanay na tayo. At very important yung nabanggit kanina na wherever you go, no? Wherever, kung regular na paglabas lang yan, pamamalengke, or magta-travel ka, especially locally, yun nga, wear mask at all times. Minsan nakakaligtaan natin, lalo na nitong mga nakaraang buwan na medyo bumaba yung kaso. So parang naging kampante ang ating mga kapatid, no, yung public. Pero dapat tandaan natin, nandyan pa rin ang COVID-19.
Factors to consider before booking your holiday. We'll give them to you after a short break. We're your connection to healthcare. Stay with us. As the economy starts to open up, more beaches and provinces welcome local tourists. But nowadays, the best way to travel is to plan it out. We'll help you go through things to consider before booking that all-important holiday. This is MedTalk Health Talk, where your health comes first. Now, the most important factor to consider when traveling is the location. And it's important to look up the viral caseload and maybe the test rate of the place you're traveling to, as long as the local government unit's protocols and rules. What we want to see here is the fewer cases of COVID-19, the better. Now, going to Secretary Puyat, what would you suggest are the safest travel locations for our viewers to check out?
Well, the safest normally, when we actually did the travel survey during the height of the pandemic, and travelers normally, first they want to travel by land. They first want to go around their municipality, around their city, and go by land. So some are still scared to travel by air. It's really up to the traveler if what they're comfortable with. Continuously check sa local government unit, or if they're booked in a hotel, to always ask kung is it safe already to travel. But basically, pag naka-MGCQ naman, it means that tourism is allowed and the cases are low. Basta pag MGCQ. So they're good to go if the place they're going to is under MGCQ.
Okay, good points to know. Now, another important factor to consider is syempre yung accommodations or where you will be staying when you travel. Dr. Camacho, what are the safest options for our viewers? What should they be looking out for?
Ayan, so very critical, no? When we travel, we need to choose, no, the right accommodation or hotel. So, paano tayo makakapili, no? So, we go to the websites of these hotels or yung ating accommodations nga, whether health and safety protocols are in place. Yung minsan yung ano lang, no, yung cost lang din yung tinitingnan natin. Pero at this point, no, in the new normal, no, when choosing accommodations, we need to look at the compliance of these establishments to health and safety protocols.
Dr. Camacho, how does testing help really? And when is the best time to get an RT-PCR test?
Ayan, so testing is very important, no, for COVID-19, especially if you're going to travel. Kasi, syempre, malalaman natin whether we have the virus or not. But we need to be very cautious, no, when it comes to testing. Sabi nga ni Secretary kanina, it doesn't mean na negative ka ay 100% na wala ka ng virus, no? Pwede, ang nangyari kasi is nung time na kinuhanan ka ng test, hindi pa detectable yung virus. No? So dapat alam natin yung mga limitations ng testing na yan, no? As to when is the best time to test, especially if you're going to travel, the Center for Disease Prevention and Control recommends actually 1 to 3 days before traveling, no? Doon ka magpakuha ng test, and then pwede ring 3 to 5 days after, no? Pagdating mo dun sa sa pinuntahan mo. So all of these measures are actually working together, no, para mas lalong mapababa ang risk of the transmission of the virus.
Secretary Puyat and yourself mentioned that yung RT-PCR ang dapat na test, ano? But maraming Filipinos have access to ang tinatawag na antigen test. Pwede na ba itong antigen test? Is this something that Filipinos can use in replacement of RT-PCR?
Well, in our IATF, because the DOT is a member, of course, you are both doctors. Antigen test is actually more effective if you have symptoms. And if you're a positive, pero maraming false negative. So, a lot of people want to do antigen because they think it's cheaper than an RT-PCR. But the Department of Tourism, through the TPB, already subsidizes RT-PCR. If you go to UPPGH, the RT-PCR test is already 900 pesos and the results come out in 24 hours. If you go to Philippine Children's Medical Center, because the DOT has subsidized it, it's only 750 pesos na lamang. And the results come out in 24 hours. So, cost is not a factor. Kami sa DOT, though I've said that it's the LGU that calls the shots, except for Boracay, we would rather go for the gold standard, which is the RT-PCR.
That's right. And an RT-PCR is way more accurate than any antigen test that you can buy. So an RT-PCR is still, as Secretary Puyat said, is the gold standard. So yun ang dapat na test na kinukuha po natin whenever we think of traveling. So remember, a negative test result doesn't mean that you can skip other COVID-19 precautions. So how do you protect yourself when flying? We'll talk about the ways when we return. Keep it here on CNN Philippines. When layered, the many ways to protect yourself can keep you safe. And the risk when traveling won't be eliminated, but it will be significantly lower. Now, let's go through the do's and don'ts when flying in this new normal. Welcome back to the program. I'm Dr. Freddy Gomez. Because of how air circulates and is filtered on airplanes, most viruses don't spread easily on flights. And the danger mostly lies in the airport and if there is close contact on the plane. Dr. Camacho, with that, what are ways in order to protect oneself when flying?
When flying, it's very important, again, no, before tayo pumunta sa ating mga destinasyon, yan, lalo na sa airport, ay to look at the requirements of the protocols of the airports, no? Yung panggagalingan at syempre yung destination natin. Para maging handa, dapat aware tayo kung ano itong mga protocols na ito para pagdating doon, like for example, mask is very important again, no? Parating hindi naman mawawala yan, and also the face shield dito sa atin.
Yes, napaka-importante talaga yung mga protocols na yan. Now, Secretary Puyat, as someone who has needed to travel extensively during this pandemic because of your schedule, what advice can you give our viewers when it comes to traveling in places, going through security lines, going through crowded places? How can you still maintain that safety barrier and still try to get to where you need to go?
Yeah, first of all, tama yung sinabi ni Doktora, talagang yon. But I have to admit nga that the first time I started traveling last June, I have to admit I was very scared. But sabi ko, nako, kailangan kasi trabaho and we really needed to restart tourism. In fact, with the LGUs, I wanted to meet with them via Zoom, but they wanted face-to-face. So that's what we always have to follow, yung minimum health and safety protocols. Talaga, always wear a mask, face shield. Again, I don't like to touch anything. I always have a hand sanitizer and kailangan may physical distancing. Kung may linya, dapat may physical distancing. At saka always, pag nagpapa-RT-PCR ako, I quarantine. Kasi yung mga iba, pag nag-RT-PCR, nagpa-party, pumupunta ng mall, tapos pag negative, good to go. But they have to understand that you are only negative at that time. What if pagka-swab mo, nagparty ka, makuha mo na nagparty ka. So parang it defeats the purpose. And if we are not careful, baka magka-outbreak sa tourist destination na pinupuntahan natin. I feel like nga, well, though I was a teacher before in my younger years, I feel like I'm a teacher again kasi paulit-ulit ako nagdidisiplina. When I go to a tourist destination, I really don't get to enjoy the tourist spot because I have to look at all the health and safety protocols of each place because I have to make sure that when they accept travelers, that it will be safe, not only for the travelers, but also yung mga nagtatrabaho sa turismo, they are going to be safe.
Thank you very much for joining us, Tourism Secretary Berno Romulo Puyat and Family Medicine Physician Dr. Vivian Camacho. We appreciate your time very much. Choose well and be well. I'm Dr. Freddy Gomez, and we'll see you again next time. Stay safe, everyone.